In the interest of being timely here, we're going to go ahead and get started. Welcome, everyone, to our COVID-19 Response Fund update. Glad to have you all here. I'm Sue Anderson, and I'm chair of the board of the Community Foundation Boulder County. Welcome. I hope you and your families are safe and figuring out how to navigate this interesting moment that we're all in. So thanks for joining us today to hear about our COVID-19 response. So since the first grants were made back in March 20th, actually, from our COVID-19 response fund, we've granted out 1.2 million to Boulder County nonprofit organizations that are on the front lines, as well as some funds going to the statewide Colorado COVID Relief Fund. And this has really been possible because of all of you and who are our donors and our partners in this work. It's really over the years, that partnership, all of these partnerships that have allowed us to, in this moment, respond rapidly as the pandemic emerged, as we have done in the recent past with fires and with the flood in 2013. So we want to start by just thanking all of you for being part of that team to make that happen. So just so you know, if you haven't seen it already, a written report about our grants from the COVID-19 Response Fund is now available on the website. It's also been pushed out on social media, and I believe in the June e-newsletter that was sent out today. So look for that. And before I dive in, I want to cover a couple of things, housekeeping type things, logistics about how today's webinar is going to work. So we're going to have two parts. We're going to do a presentation and an interview between two key staff members in this. And then we're going to break out into breakout groups through the magic of Zoom and have some short discussions. Note that the webinar is going to be recorded, so just so you know that. And I would also ask everyone to mute your microphone and turn off your video for the presentation portion so that we don't have background noise, and also we conserve bandwidth by turning off the videos. So if you're not familiar with Zoom, the speaker view is in the top right-hand corner of the screen, and that's what is recommended for when we're screen sharing PowerPoint and when the speakers are speaking. So with that, I'm gonna turn off my video in a moment, but introduce two members of the Community Foundation staff, Chris Barge, who's the Vice President of Strategic Initiatives, and Lisa Moreno, who's a Senior Program Officer. Chris is gonna be the moderator, and Chris and Lisa's gonna, I think, be interviewed by Chris. I'm not sure exactly how that's working, but I'm turning it over to Lisa initially to get started and give us a brief PowerPoint update of the COVID-19 fund. Thank you.
You're muted, Lisa.
Thank God for the little unmute button. Hi, everybody. I want to personally thank you for all these funds, and I hope that the slides that I'm about to show you give you a basic background to figure out sort of where we've been inside the Community Foundation over the last few months and what you've enabled us to do. So I want to take you back with this slide. This is from Track the Recovery. It's a collaboration of a lot of different sources, including Harvard and the Gates Foundation, and you can actually look at county level data here. So it's really interesting. But if you look back, most of what I'm going to show you right now is between March and the end of May. And so when we were beginning to think about what was, as we started fundraising, what is this fund going to focus on, you can see where the infections, the cases, identified cases were, and then where we are today. So I just want to kind of give you, if you look from the 1st of March to the 1st of June, kind of gives you the landscape of what we've traversed here. When we were starting to put this all together, we, like everybody else in the county at the time could see this coming our way. We were waiting for, everyone was waiting for city and county guidance and from nonprofits about what their services would be. We were beginning to go remote, trying to get ready for that. And we were frantically putting this up, trying to figure out what this would look like. And at the time, based on the information we had, we decided that it was going to be most important to support the services for those people who were at the nexus of being most at risk of contracting the virus and those who were already most vulnerable in our community, because we figured that those who were most vulnerable would be even more vulnerable because of this virus. And so we quickly identified that we knew we wanted to focus on people who were unhoused and are isolated and vulnerable seniors. Then we figured people who were living in congregant living situations would also be extremely vulnerable. And then we knew that undocumented residents in the county would be particularly at risk. So we also sort of imagined, as we mapped all of this out, granted with, you know, a certain blindness because where we were in all of this, that there would be this quarantine stay-at-home order phase, and that if it worked, then there would be fewer, the intervention phase would be less, but we didn't imagine it would ever have lasted as long as it did. But also in that would be the resulting economic and social impacts of everybody staying at home, or social needs because of everybody staying at home. But again, we didn't imagine that it would last as long as it did. And then the intervention phase, we imagined would be like significantly higher rates of infections than we ever actually landed on, which is, you know, great, but that meant that people stayed home further or stayed home longer. What we imagined were overwhelmed hospitals and, you know, much like the flu of the early 1900s. So it was more of a medical idea of medical interventions that we would be funding at that point. And then we figured at some point we would see the other side of this, and we would then beginning to figuring out with the money we had to help families and nonprofits and businesses and local governments stabilize. Because we didn't know at the time how long any of these phases would last, we decided that we were going to split the funding up and try and stick to around 30% of the funding for each phase as we went through. Well, reality as it evolved and exists today is much more overlapping and complex. It's literally quite braided. So making those decisions at the time, we were using this framework. We stuck to the framework as well as we could, and we moved away from it where we needed to in response to what we were seeing. So this is a summary again from March to May. We were able to raise, thanks to all of you, 1.6 million from the community. The community foundation itself invested 128,000 from that came from existing funds within the foundation. We were able to raise just over 200,000 from other funders, corporate and foundation funds. The total granted just from the COVID funds that we raised was $984,000. And the total amount granted with the co-funding from other funders was just over, was almost 1.2 million. So we were able to give out, let me get this number, I don't want to get it wrong, 127 grants between March when we started this and the end of May. And that signifies a 267% increase in the number of grants the foundation put out in the same 3 months in 2019. And in addition, so the 1.2 million of the total amount of new dollars coming into the county, that's local dollars, so not state or federal funds. The amount that this fund contributed to the county makes up 32.5% of the total new dollars, local new dollars coming into the county during those 3 months in response to COVID. So that includes city, county, and other foundation funds. So this is the big picture of where those 127 grants went. You can see that the bulk, the huge investment was made in nonprofit healthcare, and we had a big boost on that from Medtronic. We invested, as you can see here, our original populations identified. There's a lot of overlap in some of these. For example, the FRCs also have food banks. The FRCs also provide cash assistance to undocumented people. So there's a lot of overlap, but this is broken out as best as I could do it. The final thing I want to leave you with is this again is from Track the Recovery. As we move into recovery and think about recovery, I think that this is going to be a very important number to keep a handle on, keep in your mind as we begin to move into those conversations. You can see June 1st, low income employment is still, it's climbing slowly, a little bit flattened out since the 15th of May, but still quite low. And that's what I have for you.
Thank you, Lisa. And thank you everybody on the call for spending some time with us today. As Sue mentioned at the top, Lisa is our Senior Programs Officer, and she really has been at the leading edge of our grant making, which so many of you have contributed to, and we're so appreciative. Lisa and I work together on the program side of the shop at Community Foundation Boulder County, and really appreciate that overview. We're gonna do a little bit of a Q&A interview format now. I also wanted to just mention, as you're listening to this interview and questions occur to you that you would like to ask Lisa, please just plug them into the chat box, and we'll keep an eye on that, and I'll try to filter those in here during our time with our interview. But Lisa, thank you for that overview. Oh my goodness, what a difference a year makes. You would think you'd been in this seat for a decade, the way that you're speaking with such command, having reviewed all of these needs and thrown yourself into this moment. But the fact is that probably about, what, 1 short year ago, you were new to the Community Foundation Boulder County, and you were coming back after a stretch in living in Alaska. And since then, on no one's work plan, here comes COVID-19. The world has entered this global pandemic. Our country has begun to reckon with racial injustice more deeply in response to the murder of George Floyd. First question for you, how on earth have you kept your bearings in the midst of so much change?
So my 1-year anniversary is tomorrow.
Wow.
I guess I would say partially I think I am used to change. It's when things stop changing that it's time for me to pick up and move again. Being a military brat, I'm on 4-year rotations. Things that keep me grounded, really, I'm pretty task oriented. So tasks, day-to-day things, food, dog care, cooking well. As some of you know, I did decide there wasn't enough going on, so I completely redid portions of my house during this, and I also tore out my entire yard, just, to keep things moving. I think that one thing about doing things like that, as I was reading about landscape design, there was a quote from somebody who said that the hardest part about designing something like a new yard is that you have to imagine beyond what's already there. And I found that so relevant as we begin to think about recovery and that nexus between this pandemic and the protests and the opportunity for change.
That's a great metaphor. I mean, I think everyone on this call can think back to 2 or 3 months ago, and it feels like much longer than that. We've had so many opportunities to kind of try to find our bearings. And thank you for sharing how you personally have done that. I want to wind back the clock now. Just 2 or 3 months ago, back to March, this pandemic is, it's here. We've closed the Community Foundation offices. The world is all of a sudden seeming very much, very different. And we on the program side and everybody on the Community Foundation team is saying, okay, we're raising a fund, we're working with donors. Share with us a little bit about the initial thinking. How on earth did you think about how to do the most good with these dollars towards a pandemic that wasn't even on the work plan?
Well, I used that first graph about infection rates because COVID cases, because I find it very hard to think back to March at this point. And to be perfectly honest, I find it difficult to think back to last week or a few days ago, Friday for that matter. I think that there's 3 types of time now, right? There's Chronos, there's Kairos, and then there's COVID. And COVID, it all just mushes together. Which is just a reminder of what a social construct time is. But when I think about those early days in March, what I remember about it is standing in at Gretchen's desk and the 2 of us literally mapping this out on pieces of paper. Like, what do we know about this? Based on what we know, who's going to be most impacted? Okay, put those people on one piece of paper. Well, where are those people? And then who in the community do we know provides services to those people? So who are we likely going to be needing to stay in touch with at the beginning of this to see how it rolls out? It really was just that, pieces of paper and pens and just moving the paper around, trying to literally map out this whole thing based on, super limited information at the time.
I've come to learn and appreciate so much about you and the way you work, Lisa, in our 1 year. Congratulations, anniversary coming up tomorrow. One of the things I know about you is that you take the responsibilities that you take on very seriously. As you think back 2-3 months ago and you were sketching all this out with Gretchen and others on paper, what were you the most afraid of?
Getting it wrong. Hang on, don't say anything yet. It seemed like the stakes were quite high. I think I got most scared when Boulder County did their first round of furloughs. Jeff will remember this. And I actually, I want to share this. I found something that made sense to me at the time that helped me figure out how to relate to it. And I shared this with Jeff and I think Chris at the time, and I'll share the source afterwards. I don't want to immediately blow apart anyone's bubble of believing that I might actually be well-read or erudite. For hundreds of billions of years, in fact, from the birth of time, every black hole at the center of each galaxy, the gravity of every gazing star, each hydrocarbon and chloroplast, each photon of sunlight, atom of breath, and even shy colors like brown and green in the meadow, have been conspiring to guide me to this very minute when I have no choice but to fall in the dust on my knees, to spread toward the wind and sky. My arms, useless as they are as wings, and here confess, I don't know what the F-bomb is going on. And only now am I capable of praying. Forgive me. I love you. Thank you. I'm sorry.
That's so beautiful, Lisa. If anyone on this call wanted a little snapshot of the way Lisa approaches the world. I think you've just witnessed a beautiful moment. Thank you. So lots of burden there. Also, it's times like these when it feels like an honor to work at a community foundation, doesn't it? I'm wondering, in doing this work, what has given you the most hope?
It's been, I have been amazed at the commitment of the organizations that are providing services to the people who most need it. Their ability to adapt, to charge ahead with faith, not having any idea how they will be paying for it, honestly, for some of them. Just doing what is required because it's required to take care of the people that they serve, and doing it with a tremendous amount of love. I mean, to the extent that any of this has been heart-wrenching for me, I'm not on the front line, and they've been doing an amazing amount of really great work for a long time.
Lisa, someone in the chat just asked, who was the source of the powerful quote you just shared with us?
Rob Bresney.
Oh, Rob Bresney. Wonderful. I want to take this opportunity to also mention that today, hot off the presses from your community foundation, Boulder County, is a new COVID-19 grantee impact report. I'm assuming you're on our mailing list, and certainly if you're not, we can get you there. But I was just reading over it this morning and so taken by it. It's really a document. It's about 14 pages. It's worth going through as someone invested in our county here in Boulder County. It gives you in very clear, bite-sized, digestible little sentences and paragraphs what the funds for this COVID-19 relief effort have gone to at each of the organizations that were granted, a little bit by the numbers on what impact it had. And then it asks the grantee organization also to share in a sentence or two what they see as the emerging needs for their organization going forward. So, you know, Lisa, now we're moving up in the chronology now from March kind of into April, and those first grants were directed by staff. They were also with input from experts in the community that we collaborate with and work with often. And then there was a decision made internally to not do directed grants, but to put out a RFP, to make a grant application. Talk about the logic and the shift from let's get money out to let's pause and hear from grantees.
I think in the early days, as everyone was scrambling to adapt their service models to delivery options, meeting the needs that were showing up, it was fairly straightforward to figure out who was serving those populations and stay in touch with them to find out what was going on for them and what their needs were. After a couple of rounds of that, I was beginning to feel a certain blindness about that. I think it's just a hard thing to do from my living room and not being able to see things and not know who else was out there doing some of this important work that perhaps might not have been on the radar. It just became a point where I didn't feel like I could truly be responsive to what the needs were in the community unless I threw it open for the community to tell us.
Thank you. And so that RFP went out. We received more than 70 applications from Boulder County nonprofits. I was part of the team that read those. Whenever I read grant applications, I am overcome with how every nonprofit is able to do so much good work right here in Boulder County. It gives me humility and empathy for the work that they do and the people that they work for and serve. I'm wondering, as you look through these 70 applications for funding, what did you learn that surprised you?
One thing I learned was that no matter how short we made the applications, that the amount of time that it took to read through all of them was surprising. I think that the one thing that stood out to me about that round was how many different organizations were moving into providing cash assistance for basic needs. That's probably it. I mean, I had spent so much time talking to so many organizations before that round. So, I mean, maybe Chris, what did you find surprising since it was all new to you?
I'll just share, one observation that I made right away was that there seemed to be kind of two categories that nonprofits were splitting into. One was, we are built for this. We are healthy and strong heading into this, and we are leaning into serving our clients, and we're trying to add like new layers of what we do. Please help us with that. Help us fund. And then in other cases, and this is true of both nonprofits and government agencies, if there were already cracks in the system, if they were already, struggling, then boy, the weight and the crush of this was like, it became an immediate question of financial survival for the organization itself. And so it was really, really eye-opening, just about the levels of struggle. If you're going to succeed in serving in the middle of a crisis, you have to have years and years of a strong foundation under you in order to lean into that crisis. It just gave me such appreciation to how multifaceted this immediate crushing financial situation was for the organizations that are trying to help. So you get all these applications in. How on earth did the foundation decide which worthy causes to award grants to? And did you lose any sleep over this?
Well, grant decisions are never pleasant decisions to make. Yeah, that's never easy. But that's what frameworks are for. That's that goal that we articulated about what we were going to do with this money that keeps the guardrails on what we are considering and what we choose. And I find that helps a lot. Like that is what helps make these decisions easier. I also find that if I'm losing sleep over a decision, that it is probably the wrong decision. I mean, there's a heartbreak to say yes or no, but if I'm losing sleep, I've made a mistake.
Well, that's a wise observation. I was just thinking another observation I made as we were looking through all these grant applications was how everything comes down to relationships. These were organizations that had networks and reach into populations within our county. And that this has been a moment over these last few months where you look not at the technical aspects of what's your programming look like. You do look at that, but you also look at who are you reaching, who do you have relationships with, who trusts you. When you're moving this quickly, all the other stuff kind of fades into the background, and this social capital that has been built and these relationships that are in place become very, very important as you mobilize funding into the community. I just want to acknowledge our audience who's on the call with us today. Again, we've got about 15 more minutes of this interview with Lisa. I would love to feather in questions from the audience. I'm keeping an eye on the chat bar over here. Please, if you have questions for Lisa, just flow them over this way and we'll work them in. And meanwhile, we'll continue on with this interview. So, Lisa, you've talked with our staff and our board about how, okay, there was this initial thought that the crisis is we have a theory, it's going to unfold in three stages, right? There's going to be prevention, and then there's going to be intervention, and then there's going to be recovery. And then you've talked also about how the middle of this crisis turned out to be less about large numbers of sick people and an overwhelmed healthcare system, and more about widespread economic losses and the cascading social impacts of those losses. Which of our neighbors have been hardest hit so far?
Well, we know from county data that COVID cases are much more prevalent amongst the Latino community. But, you know, so, and I would say that in general, just like you said about nonprofits, if an organization was already had vulnerabilities, that those vulnerabilities become a huge issue in a time like this. It's the same thing with the systems in our community, whether it's healthcare or inequities and systemic racism that keep people in and out, you know, access to opportunity, or keep them from having a decent income or safe housing or permanent housing. All of these things become huge gaps and vulnerabilities right now. You know, that said, you know, what are the needs at this moment that and we're going to see more of in the coming months? You know, housing was our huge issue beforehand. Housing is going to be an even bigger issue now. The vulnerability of our nonprofit healthcare systems, also big issue before, bigger issue now. The digital divide. You know, what happens to the students of all ages that didn't have households that didn't have an extra iPad or laptop in the house to keep them connected to their school and their lessons. All of these things will become gaping wounds in the future if we can't figure out how to address them.
Thank you for that. You've addressed this a little bit. I'm wondering if you can think about what the general perspective might be out there. This is one of these unique crises that touches all of us. I mean, all of us are living differently in this quarantine, various stages of that. And yet at the Community Foundation, we have a perspective and a visibility in that only a narrow subset of our population is able to see. As you think about the general perspective in our county about how people are thinking about this, what have you learned through your job here at Community Foundation Boulder County that you would, if you had an opportunity to make everyone in our county aware of a couple of things right now related to this crisis, what might those things be?
I would want folks to know that the community foundations, both ours and Longmont, the city of Boulder, the city of Longmont, and the county around HHS issues, we have been meeting regularly and through the months of March and April daily, so that we could leverage each other's investments. We've been tracking investments. In that process, I've gotten to know a lot of those staff better, and I would want people to know that the county and the cities are working really hard to try and have a active, they are very committed to equity, and they have a lens that they actually apply to their decisions. So they're working really hard to make sure that they improve around equity. I think I also want people to know that there are some really amazing change makers out there in our community that have created headroom for changes that I think we'll see in the future. Changes that are happening now in the midst of a pandemic, but I think we'll really see it solidify in the coming months and years. And then mostly just the dedication and the can-do spirit that the leaders in our community have, that really it's like, we'll do what needs to be done and the money will come.
I want to look at a couple questions that have come in over the chat, and you can see them too, I think, Lisa. I'm going to read this one from Margaret Katz, my former colleague at Community Foundation. Her question is, it seems like there was kind of an expanding circle in the grant process, from the immediately obvious frontlines groups into other focus areas for nonprofits. Can you please share a little bit more about what you learned as you went?
So in some ways I started expanding the circle before we went to the RFP, because we had done the front lines of those vulnerable groups in terms of services. And then I began to think about people who rely on their communities to keep them alive and keep them sober. And those two things became important to me. So I started looking for the connectors, the entities that connect and provide community for vulnerable people. And we're having to make those shifts from in-person meetings and programs to online meetings and programs, and recognizing that that type of support is everything to some people.
We have another question that has come over, and the question is, starts with a statement. It seems this pandemic is going to be a much longer issue and recovery process than was initially anticipated. The question is, how does longer term funding look?
Longer term, so well, I mean, I don't know I know the answer to that. Longer term funding from whom for what? I will say that the federal money is we all know it comes in large quantities, but it's slow. So that's beginning to arrive. You know, where it goes and how it's invested, we'll see how that's overlapped with between department, like between service sectors, we'll also see. Yeah, I guess I'm not sure exactly how to answer that question.
Sure. Let's go to the next one that just came across. Deborah Simmons asks, what % of requests was for cash? I'm assuming she's asking, you know, a lot of these requests were like, look, we're pumping cash assistance out to into the community. And without getting into, I see you're referencing, you know, you may not have that, the particular data, but I'm sure you've got the exact answer, but go ahead, roughly ballpark.
I don't, so actually I don't have the analysis in terms of requests for cash. But overall cash assistance, you know, between, if you remember back to the chart that I showed you where our grants got, if I combined all of the cash assistance, we would be about pretty close to parity for what we invested in healthcare in terms of cash assistance. So we would be like from pretty close to $300,000 probably in cash assistance efforts. Did I lose you?
What will you seek?
Can you say it again? You froze.
Right. Oh, I'm sorry. The question is, what the heck, where are we right now? Is this the recovery phase? You know, and that's what we sort of thought in our head. And if so, what data do you look for to analyze and to be smart about these investments? And what type of input, whose input do you seek to try to turn these grants around?
Yeah, I was just talking to Eric at the Longmont Community Foundation kind of about this question this morning. You know, on one hand, I want to say, no, I'm not sure we are in recovery, but the reality is that it's all like one braided, very large, complex braided river, and we're on this traversing path that keeps going back and forth across it. So it's complicated, and I don't know that we necessarily know. I think what we'll see is like one piece of things that's in recovery, and one piece of things that's actually back in prevention, and one piece of things that's in intervention, and that maybe it's going to be like that for a while. And I think that that's a complicated thing to plan for and think about funding. I mean, I think it's a complicated thing for us at the Community Foundation to figure out, because it means that in many ways, does this fund actually go away? What happens to it? I mean, these are all questions that the whole community is going to have to wrestle with for the next, you know, who knows how long until there's actually a vaccine. In terms of data, I mean, I think we need to be looking at these trackers that I showed you are great, showing employment rates and income rates and eviction rates and consumer spending, and recognizing that we have to respond to the short haul, but we still need to be planning on the long haul. Like, how do we begin to take those things that we know are gaping vulnerabilities and begin to close them, so that as this continues to cycle back, this virus continues to cycle back, that the holes that we have in our safety nets are smaller and smaller as we move forward. So it's going to be a complicated balance, not just for our fund, but I think for everybody in the county, to figure out, like, how do we address those needs as they continue to rise? And then how do we also begin to address things that are, I've been calling BHAGs, like the digital divide and things like that.
So my last question, and then we'll break out into some focus rooms here. But let's talk about these twin pandemics. It's not just COVID-19. It's America's reckoning with structural racism now. When you think about all of this together in the middle of this grant-making process, how has this moment shaped the Community Foundation's thinking?
I think that the pandemic has helped the scales fall from everybody's eyes, so that we can truly understand the data that we see. Like, why does this virus in our county disproportionately impact Latino residents? It's because of all of the things that also create, I mean, it's systemic racism and inequality, inequity. We as a foundation had already moved to centering equity in our mission statement and in our work. And I think that we've been slow to concretize and make transparent how we were actually stepping into that work. And I think that this has given us the clear pathway to move into that more explicitly without any concerns. And, honestly, we're late. But again, back to my quote, right? Forgive me, I love you, thank you, and I'm sorry. There's nothing else to say but that.
There is nothing else to say but that. Thank you, Lisa, for your incredible work and for your deep, helpful insight. I now want to transition us. We're going to have an opportunity to split into smaller groups. I'm going to invite Peggy or whoever might like to chime in here. And I'm happy to share the 2 questions that will be asked in the breakout room. Why don't I just say those questions? And then here we go. We're transitioning to our breakout rooms. So there will be a staff member and a note taker. We'll do this for 15 minutes and you'll learn what the questions are in the breakout rooms. Thanks everyone for participating on this really great webinar. Well, hello everyone. I'm going to give us just a minute here to reconvene as a group. It looks like maybe we're all here together. We've had, this has been a really meaningful time for me. I again want to thank you, Lisa, for sharing with such candor about this whole process and the recovery and how you and the Community Foundation are thinking about this. We've now had a chance. I'm told that we're waiting for one room to close. There seems to have been a very engaging conversation that's just coming to an end. So, okay, now I'm told that we're all here. Well, welcome back, everybody. Now is our opportunity to hear what was said in the breakout rooms. So let's see, I'd like to invite each of our leaders to just unmute yourself if you've been designated to report out, and please go ahead with a quick summary of what you heard.
Hey, Chris, I'll go ahead and go. I think we were breakout room number 1, and I think that the focus of our conversation was twofold around the struggles, and those were really around how does the role of small business in the community and how that is such an anchor to a community, and what will be the long-term effects of some of the fallout from COVID of those small businesses and those opportunities for those organizations to come back, and how do we support our main streets, if you will, so restaurants and other small businesses, and then also sort of understanding which of those businesses is impacted more, and how small businesses that are owned and operated by underrepresented communities or minority communities, and what supports will be in place, and how do we plan for kind of a longer term sort of rebound and support, if you will. And then, you know, putting on my Boulder County hat, I kind of shared just the concerns around how do we brace for what is coming in terms of people's need to adjust for healthcare, and how do we plan for what, you know, is going to be, you know, sort of hitting us in the next few months to the next 18 months, depending on what the economic situation looks like. But through all of that, there was hope. And I think the hope is that we will find solutions that are going to support our community, and that we've been able to adjust so as our nonprofits and, you know, our restaurants and, you know, things like Boulder County have been able to continue services in this new world. We found new ways to do our business model. And so I think that sort of having that agility and adaptability is going to help us as we move into the future, depending on the length of what this pandemic looks like and those changes.
Wow, your group had a lot to say. Really great, insightful comments. Thank you so much. Let's go around the horn here to breakout number 2. Sue and Jennifer were the leaders. Who has been designated to speak for this group? And let's keep it to about 2 minutes.
Hi, I'm Jennifer. In our group, I guess starting with concerns, identified one, the educational gap, and the fact that anecdotally they're seeing one teacher saw a lot of students 20-30% of the students dropping out as learning went online, and that was really along socioeconomic and racial lines. So concern about that, concern about coronavirus getting worse, and the impact that that might have on the healthcare system. And then there were some hope that as we work together as a county, that would also ripple across and be something that would happen on a countrywide basis. A hope that perhaps standing in the gap here, more individuals needing healthcare as a result of unemployment, that perhaps there could be improvements to healthcare offerings that aren't simply employer-based. A hope that we could bounce forward, that we could accelerate the action that is currently taking place on different relevant issues like climate change and emissions reductions. And then a hope that the community will really continue to rally and come together and hopefully do so around those most vulnerable populations.
Great. Thank you, Jennifer. A lot of really, really great insights here. Let's move now to breakout number 3. Brad and Peggy were facilitating. Who has been designated to speak for you?
I was left standing when everybody else shook their head no. I was also the moderator, so I wasn't taking notes. So youth, the vulnerability, the collapse of programs, the defunding of programs was a concern. Immigrant populations, we were mostly a nonprofit group, less a business group, talking about Intercambio, Teens Inc., et cetera, et cetera. You know, I think the framing of our discussion was sort of like recovery. What recovery? Not to give up hope, but just to question the entire premise that seems to be circulating in the culture at large. You know, I think there was brought up a profound question about what happens when 25,000 students return to town August 1 when their leases begin. I think we've already gotten a little picture of that in the last couple of weeks. I live next door to a place where frat boys come and do what they do. You know, the question is also just as Lisa referenced, just the profound level of dislocation, suffering, anxiety, fear in communities who don't know what's next because they don't have money to buy maybe groceries, certainly not an extra set of tires for the car that no longer works. There was a suggestion of if there are funds left in the funds raised so far by the Community Foundation, perhaps accelerating that under whatever rubric exists, and also the anxiety that what comes next in 2021 after funds have all been dispensed early and quickly to take care of the immediate crisis. If I've left anything profound out for my group, please join in and let people know.
Great summary. Thank you, Brad. You know, the Brookings Institute is out now with a report whose headline is that race gaps in COVID-19 deaths are even bigger than they appear. And so we at the Community Foundation, as we reckon with these two pandemics, are really redoubling our efforts to focus on a vision of equity as we try to pull out of this crisis. And you know, Brad, you said it really well right there. Recovery, what recovery? You know, where are we? Earlier in the interview, Lisa said, you know, our whole concept of time is being bent. It's abundantly clear how malleable that concept is now. But thank you for that input. Briefly, I'm just going to report out from the group that Matt facilitated. And I would say, you know, there's some very basic needs that the people on our call are concerned about, whether it's food or housing, mental health. All of these are continuing to be on our minds. One of our callers called it these last mile problems. And they also wanted to point out that they thought, Lisa, 1 year in, you're a terrific person for this job. And so express some real deep appreciation for what you're doing and leading us in this work. You know, we also talked in our group just about how many small businesses have been put through the ringer. How will that recovery be addressed? And this sense of urgency. It's both a sprint and a marathon. It's happening right now. It needs attention right now. And oh my goodness, are we in this for another week, month, years? Well, we need enduring marathon type attention as well. And so the Community Foundation is very interested in all of this input, and we're certainly working on both the sprint and the marathon simultaneously. Okay, let's hear from our last breakout group. Sarah and Caroline facilitated that one.
Hi, so my video is not working, unfortunately, but I'm reporting back from our group. We had an interesting group of individuals who mostly work in the community with vulnerable, those who are vulnerable during this virus, and felt like the virus, the COVID has shined a light on homelessness, global warming, inequities in our community and our world, but also saw this as an opportunity, as one person said, not just to put a Band-Aid on some of these problems that have existed over the decades, which has kind of just perpetuated some of these problems, but really maybe it's an opportunity for people to quote unquote get it and hopefully make a longer lasting change. Let's see, what else? There was also just, it was mostly around just, this is an opportunity to be more aware of the impact on the vulnerable. Tiffany works at the shelter for the homeless and said, one of the things that this has really put a spotlight on is those, there's a recognition that we cannot have stay-at-home orders for those in our community who do not have a home. And this is an opportunity to look at homelessness as a national health crisis. It's very tangible for greater movement around this disparity. And Deborah pointed out that so many of our systems are interwoven, and that to make a change, it's kind of like the cog, one change affects the rest of the systems. So that's kind of our brief discussion. Is there if I left anything out and you were in our group, please jump in.
Thank you, Caroline, and thank you all for your heartfelt input, for your investment in your community, and for all of the ways that you continue to partner with the Community Foundation. Truly, we accomplish more together than alone. We're about to wrap up here. I'd like to turn it back over to our board chair, Sue Anderson, for some closing words.
All right. Thanks, Chris. And thanks to both Chris and Lisa and everyone here for joining us today. I think it's an important conversation to have and to continue having about, how this pandemic is affecting every aspect of our lives, and how we who are more or less resourced on this call can be supporting folks who are really at that intersection of the pandemic and existing inequities and vulnerabilities in our society. So I mentioned at the opening that our COVID-19 Boulder County Response Fund grant report is up on our website and in social media and wherever it is you get your information about the Community Foundation. So take a look, and by all means give us a call or send us an email or do whatever it is you do to communicate with us these days if you have any questions. And I also wanted to call to your attention something that you're going to be getting shortly via email or snail mail or various ways that we're pushing it out, and that is that we're doing our annual appeal for our operating funds, because we have to be able to continue to operate, as is true of all of the nonprofits that we're pushing out grants to. We have to operate as well, and so we're moving that up. We usually do it towards the end of the year, but we're moving that up, and you're going to be getting that request. So if you would consider making your annual operating gift early this year, that would be most helpful to us as we continue the work that we're doing to support our community in this time. So we know that it's a tough space that our whole community is in, but also particularly in the nonprofit sector that are dealing with these frontline issues and providing services to people who are really in pretty dire straits. And those nonprofits themselves are trying to raise enough money. So we want to be able to continue to support them and continue to support people who are so disproportionately affected by this pandemic. And your support helps us to do that. So so give early to us, but give early to all of your favorite nonprofit organizations as well, because we're all in a world of hurt and we're all going to need it this year, because who knows what's coming for the rest of the year. But we're going to be optimistic and have hope. So thank you, and be well, everyone, and stay healthy, and we'll see you at our next webinar. Thank you very much.